depression before. So is it really hard for somebody that was never depressed before to actually, just to realize it, and is it harder?
Yes.
Is it, yeah,
Yes.
Hey, okay, this is going on.
So, a lot of times new mothers especially will feel a detachment from their baby, and they just don't know why. They don't understand why they don't feel happy and excited, and everyone around them's happy and excited, and so they start to think in ways of what's wrong with me, why am I not so happy and excited now? The stress of having a brand new baby at home, lots of changes are being made, especially for women with careers. They have to take off work, they're not used to that, they have to stay home, they're breastfeeding, it's every 2 hours or so, and so it's just on and on and on and on.
Yes.
And there's a lot, right, there's a lot of different changes that are made all at once. And so a lot of times women have a really hard time dealing with that and understanding what is wrong with me. And so their parents or their friends or their family members, their husband, whoever, might notice, you're having trouble dealing with this, and we need to get some help. Best way to get help is to call a psychologist. To call a psychologist. We are the ones who are specialized in treating depression with regards to no medications. So psychiatrists are the ones who prescribe medication. Psychologists are the ones who you sit on the chair, you sit on the couch, and we talk about what's going on. Particularly in our clinic at Rejuvenate, we treat people with cognitive behavioral therapy. What that means is that it's taking a look at how the person is interpreting the different things that are going on around them. So for instance, if the woman has had the baby and she's struggling with all of the new changes, and she starts to tell herself repeatedly, what is wrong with me? Why can't I handle these things? I'm not meant to be a mom. I just don't get this. Why can't I do these things? Typically those thoughts will start to generate lots of different emotions like anxiety and frustration, and that can lead to depression most of the time.
Obviously, there's a lot of money involved, so how insurance coverage, how does it work with all this?
Sure. Most insurances cover mental health. So if all you have to do is make a phone call, tell us the insurance information. We take down all your information, we verify all of your benefits, and depending on if you have a deductible or not, it's pretty easy. If the person has a $500 deductible that they haven't met yet, say it's the first of the year, they haven't met that deductible, then you'd have to pay the $500, and then after that you just have to pay your copay, just like any other doctor.
You have to go to your primary care physician first?
No.
Okay.
No, you don't. You can make a phone call. It's your mental health benefits. It doesn't have to go through a primary care physician. What typically happens, though, we have a lot of good relationships with OBGYNs around the area, and the typical problem, if it arises and the person starts to notice it, they'll make an appointment with their OBGYN first, and they'll talk about what's going on with me, why am I not feeling right, and the OB will make the referral to a psychiatrist.
Treatment last? I mean, how long does it take?
Treatment lasts...
Can you be cured, first of all?
Yes.
Yeah.
Depression. Can you be cured forever? Well, that's subjective, because something could always happen that would cause a depression. If something happens to your spouse, or you lose your career, or something terrible happens in your life. Everyone's prone to depression, so you can't necessarily safeguard against it forever. But the best thing that you can do is to understand depression, be aware of it, understand what contributing factors go into it, the ways that you talk to yourself, how you interpret different situations. Really restructuring the way you negatively talk to yourself is the most important thing. And so when somebody comes into my office, that's what we do. I help them to figure out the ways that they're thinking about different things in their life, and we restructure the ways that they think so that that leads them to different emotions.
And typically, how long is the process last?
I tell people that if you have not seen any really good results between 15 to 20 weeks, then I'm not doing my job.
Courses that mom can go check it out, either a website or blogs or anything like that?
Sure. APA.org is always a really good website for any kind of mental health issue. It doesn't matter what it is.
Okay.
I also have several other websites that I can forward on to you. You can post on your website.
For the office, and
absolutely.
I heard that you're doing massages and
You bet, yeah.
moms, pregnant moms, massages. Ooh, that sounds
Yes.
exciting.
And we'll offer anybody who views this can come in for a $20 discount for a pregnancy massage, or a massage that you just need some time away from the kids and the husband, and just enjoy your time here at Rejuvenate.
Well, thank you.